7 investigators were the first to reveal how Beaumont Health was moving patients on ventilators out of their facilities and sending them to other hospital systems. Now we've learned one of those patients died during transport, and her family is questioning why she was moved at all. 7 investigator Heather Catallo joins us now with a look at what she's uncovered.
Beaumont has made no secret about their desire to load balance patients across Southeast Michigan, meaning they took on the most COVID-19 patients and they wanted to transfer some of those patients to other hospitals. But now questions are being raised about why some patients were transferred multiple times. Lisa Cole's focus in life was family.
2 peas in the car. When you see one, they knew, and the sister love, the sister bond that me and my sister had. And now I don't have that.
The 59-year-old from Farmington Hills loved spending time with her sister Tracy, and she doted on Tracy's daughter, Lisa's only niece.
I'm really lost right now without her because she was my rock.
Tracy Cole was worried back in mid-March when Lisa got the coronavirus.
I recommended that she go to emergency because she was having a hard time breathing.
Tracy says Lisa spent 2.5 weeks at Beaumont Farmington Hills, and she was told Lisa was improving.
Tried to do a spontaneous breathing trial on her, and she passed it. And they was looking at getting ready to take the vent tubes out. And then all of a sudden they moved her from Farmington to Trenton.
Tracy is like so many family members during the COVID-19 pandemic who have had to make medical decisions for loved ones from afar because they're not allowed in the hospital to be an in-person advocate. So she approved the transfer because doctors told her it was necessary. They said Beaumont Farmington Hills was at capacity. But after only 2 days at Beaumont Trenton, Tracy was told they wanted to move Lisa again, this time outside of Beaumont's system.
And I said, well, why do you all have to move her again? Well, we at capacity, and the patients that's showing progress, we want to move them out so they can continue their care.
Tracy says Beaumont planned to send Lisa to the Veterans Affairs Hospital in Ann Arbor, even though Lisa was not a veteran. The 7 investigators previously reported that the VA took 48 patients off Beaumont's hands as they closed their Wayne location and reduced patient loads across their system. Tracy did not want Lisa transferred a second time, but felt she had no choice. So Lisa was moved by ambulance on Easter Sunday. Sadly, she never made it to the VA.
She coded in transit. That's what the doctor said to me. She coded 3 times in transit.
A Beaumont source afraid to talk to us on camera for fear of retaliation has told the 7 investigators that the Trenton ICU was not at capacity and there was no medical reason to transfer Lisa's care.
They shouldn't have moved her.
Lisa Cole's medical records from the day before Beaumont transferred her to the VA seem to back that up. On April 11th, those records show a notation that says, stable for transfer? No. After Lisa died, records show a Beaumont nurse contacted the Wayne County Medical Examiner, categorizing this as a death under suspicious or unusual circumstances. Beaumont officials have maintained it is safe to transfer their critical care patients on ventilators. During a previous press conference with Beaumont CEO John Fox, I asked if those transfers out of their system were done because COVID-19 patients are expensive.
Was that done to save money?
No, it's not done to save money. No patient is transferred unless they meet appropriate clinical criteria, and it can be done safely.
But this email from a Beaumont manager to Trenton staff on April 13th tells a different story. It says John Fox went to Gretchen Whitmer and said Beaumont Health cannot sustain all the COVID patients because financially it will ruin our business. We are bleeding money out of our system. A Beaumont spokesman said they could not comment on Lisa Cole's death due to privacy laws, but sent us a statement that says, in part, physicians evaluated all patients considered for a transfer and used their best judgment and the information available to them at the time to determine whether or not to proceed with a transfer. Meanwhile, Tracy Cole wants to know why her sister is gone.
I know for a fact in my heart they shouldn't have moved her. If they hadn't moved her, my sister might still be here.
A Beaumont spokesman also told us, quote, "Our team mourns all who have died from COVID-19, and we empathize with all who have lost a loved one to the virus. To provide all patients, both present and future, with access to appropriate care, we worked with the state of Michigan to transfer patients to other health systems that had capacity and resources." We have more of their statement at WXYZ.com. I'm Heather Catallo, 7 Action News.
Yeah, a lot more to that for sure. All right, Heather, thank you.